Hi, this is Lisa DeGiorgio Haig, nurse practitioner at UCSF Student Health and Counseling Services. Welcome to our second audio cast of Sex Talk. We're here to answer your questions regarding sex in a comfortable environment. I'm going to be doing this today with my coworker Larry Lariosa, clinical social worker here at Student Health Services, and I'm going to turn it over to Larry, who's going to introduce our topics for today.
Hi, I'm Larry Lariosa, clinical social worker at UCSF Student Health and Counseling, and today we have 6 topics. The first topic will be on pap smears and STD testing at Student Health. The second topic will be, what do you do if the condom breaks? The third topic will be condoms and erectile dysfunction. The fourth will be hygiene after sex. The fifth will be female orgasm. And the sixth will be oral herpes. So that brings us to our first question. The first question is, can a UCSF student come into student health for just a pap smear? And can you discuss where to get testing for STDs and how much it costs if you have G-SHIP, which is our student insurance?
We do pap smears here at Student Health free of charge. We call them women's health exams, and they usually include a thyroid exam, a breast exam, and a pap smear. We're happy to take care of that for you. All you need to do is call our front desk at 476-1281 and schedule an appointment with any provider here. We all do that. We also do STD testing here if it's indicated. So please make an appointment, come by and talk to us. We're happy to cover lots of issues, and we are definitely in the business of helping people practice safe sex and contracept if they need it. So come by and talk to us, and we'll be happy to provide that for you.
Okay, so the second question we have is, what do you do if the condom breaks during sex?
Condoms typically shouldn't break during sex if you're using them properly, but everybody can have a mishap once in a while. If it's a problem that's happening continuously, please come by and talk to us, because it may have to do with the wrong condom size or how you're putting it on or lack of lubrication. But let's say it's a once in a while occurrence. What you need to do if this happens is, first of all, remain calm and take a deep breath. It'll make it easier for you to figure out what the next step should be. Now, if the condom breaks while you're having sex and before ejaculation, you want to immediately stop having sex, which can be admittedly difficult to do, but you want to try to stop moving and grasp the condom as best you can and pull out with hopefully the broken condom attached, and apply a new condom, and then you can have at it after that, making sure the new condom is in good shape. Now, if the condom breaks after ejaculation has occurred, you want to do the same thing, but you want to do it even more carefully. You really want to try to hang on to as much of that condom and ejaculate as you can. After this occurs, it's a good idea to shower or wash your genital area thoroughly with soap and warm water to help remove as much as you can. And then have a frank discussion with your partner. Talk about how careful each of you have been in the past and what risk factors for any kind of STD might be. You want to talk to your partner about whether they have a history of IV drug use, whether they've been having sex without condoms with other partners, or whether they've been trading sex for money or drugs. Even if both you and your partner believe you've been safe in the past, you should get tested for HIV. And I would say other STDs. Now, it takes about 2 weeks for most STD tests to come back positive. The exception being HIV, which can take up to 6 months. So we recommend getting tested right away and then getting tested again in about 6 months. And you want to be alert for any signs of an STD, such as a rash, swollen glands, fever, flu-like symptoms, pain or discharge from the penis, vagina, or anus. And if you have any of these signs, see your doctor. Here is an important thing to remember. Women should never douche after a condom breaks. This can actually send the ejaculate up into the uterus and give it a little helping hand towards the egg, which obviously if you're using a condom you want to avoid. It can also send infectious microbes deeper into the vagina. So you definitely don't want to do that. And you also don't want to use a contraceptive foam such as nonoxynol 9, which can irritate mucous membranes, increasing the risk of infection. So just to review, to prevent the likelihood of a condom breaking, never wear 2 condoms at once. The friction can weaken the condom. Never use oil-based lubricants such as Vaseline or olive oil. This can also weaken the condom. But do use lots of water-based lubricants to decrease friction that may weaken the condom. We here like Astroglide, but there's plenty of them on the market. And make certain you're using proper size condoms and never reuse a condom. If a condom has broken and you've been exposed to semen, there's 2 things available that you should know about. There's something called post-exposure prophylaxis. So if you have a conversation with your partner and you're concerned that you may be at risk for HIV, if we're open, you should make an appointment as soon as possible to come talk to a healthcare provider at Student Health Services. If we're closed, you can go to the ambulatory care building on Saturdays or the ER on the weekend. For women, Plan B is a great way to avoid pregnancy. If you're a person who's only using condoms, we strongly suggest that you have some Plan B in your medicine chest at all times as sort of a little insurance policy. It's nice to get it at Student Health because we sell it here for cost, but you can also get it at a pharmacy. If you take it right away, it will reduce your risk of pregnancy by about 80%. So it's a nice little thing to have on hand. If you'd like a prescription for Plan B, just come talk to a provider here at Student Health, and you can get it ahead of time.
So our third question today is, what about safer oral sex for non-erect penises? My partner often doesn't get a full erection even when really turned on. It is a respectful and committed open relationship, so we always try to use as much protection as possible. Since I worry about not getting a condom on properly, I usually end up skipping the oral sex and would like to find a better solution. Saran wrap has been pretty awkward and hard to deal with for this, and the only smaller, snugger fit condoms I found aren't that much smaller than regular size condoms.
Okay, this is an interesting question, and before I start the answer, I want to applaud anyone out there who's trying to be this conscientious about using protection and being safe with your partner. It's a great way to be in a respectful relationship, especially if it's an open relationship. Condoms are really important. Hearing that a penis isn't fully erect when you're trying to use a condom makes me think of a couple things. I think it's probably almost impossible to get a condom on a non-erect penis. I can't really imagine how difficult that would be. And it makes me think about why the penis isn't erect. And it makes me wonder if this isn't more of an issue of erectile dysfunction than actually trying to get a condom on. So if your partner's penis isn't getting fully erect and therefore you're having trouble using a condom, I would try to figure out why the penis isn't getting fully erect. And there are 2 types of erectile dysfunction. Basically, there's physiologic and psychogenic. And people should be evaluated for both. And we're happy to see patients here, either together with their partners or by themselves, to discuss this. But the quick way to try to figure it out is, if a man wakes up with an erection or is able to get an erection on his own but can't get an erection with his partner, it's probably psychogenic, meaning that the cause of the erectile dysfunction is psychological and not physiological. Certainly if somebody isn't ever getting an erection, either by themselves or waking up with one, then the problem may be physical and they should come in and we can evaluate them for that. There's good solutions for both. I mean, a good physical evaluation has lots of solutions, and psychogenic erectile dysfunction can be happily treated with Cialis, Viagra, or some behavioral approaches. So what we really like people to do is come in and get evaluated so we can try to figure out why the penis isn't getting erect. And then once we figure that out, it's much easier to get the condom on.